Hey everybody, welcome to my channel. My name is Michelle and I'm going to be touching bases on how to become a medical assistant instructor. I would ask you all to subscribe to this video, like, comment, and share. Any questions, definitely I'm willing to answer them for you. But what we're touching bases on today is we're going to talk about how to become a medical assistant instructor. First of all, I'm going to let you all know what a medical assistant actually is. A medical assistant is going to be the first person that you see when you walk into a doctor's office. They have one of two roles. It depends on which one you choose. A clinical medical assistant front office is going to be somebody who actually takes phone calls for the doctor's office. They're going to be the ones who actually schedule your appointments. They're going to be the ones who actually you see leaving so that they can actually follow up with you. Also, they take co-pays. They update insurance information, etc., etc. A back office medical assistant. This is the generalized form of a medical assistant. This is what people think a medical assistant actually is, which it is true. It's just a different part of medical assistant. This is the more hands-on part. So this one, you're going to call the patient back from the waiting room, and you take them back. You actually get their height, weight, blood pressure. Any tests that may be done, you can actually run them. So for instance, if you work in a gynecologist's office where you see women, then you would work and you would actually, if they're there for a pregnancy test, you can run the pregnancy test. You can give, depending on the doctor's office, you typically can give shots or injections. You do blood draws, etc. You do things like that. So you're hands-on. You can also, like if you work in a, just a regular doctor's office, you can do vision tests, you can do hearing tests, you can do pulmonary testing. So there's so many different things that you can do. This is, if you're interested in this, you could do EKGs and things like that. So you're more so side by side with the doctor in a way, and you assist the doctor in anything that they need. So you clean the rooms, wipe down, you make sure everything is stocked. So you have a lot of experience in this role. You can leverage with both of these types of medical assistants to a lot of different careers. Just to kind of touch bases a little bit, you can become an office manager with additional experience. You may have to go back to school for that, but that is something you can do with being a medical assistant. It gives you that aspect of how an office is ran. But to get back on this topic of what I was actually speaking of, as a medical assistant instructor, that is basically a teacher who allows you to understand the aspect of becoming a medical assistant. So what you would do as a medical assistant instructor is you would have a classroom of students who know nothing about medical assisting, or even if they do, if they're there for another year, then they're continuing to learn the aspects of the medical field. So they actually are your students. You're going to come up with materials so that they can learn. You're going to grade tests. You're going to directly show them how to draw blood, show them how to give injections. You are going to be their instructor. You're going to be at the forefront of your classroom. And typically, medical assistant instructors report to the program director, and you go over different material that you have planned for your students, etc. These medical assistant instructors can start off making, I would say anywhere from 2022 start, and that's a salary-based type of job. So of course you have to do homework, you have to grade tests, like I said, etc. So this is a really in-depth career. It does take a lot of consistency, persistence, but it is a really, really amazing career. So if you're looking to become a medical assistant instructor, you do have to be a medical assistant in the field for 3 years. Some companies make it imperative that you have to have a teaching degree, which not all companies do that. So depending on where you're going, sometimes you don't need that additional teaching degree to have a classroom to teach. As long as you are comfortable with doing that type of job, then it's something that you can do. I would highly recommend it. This gives you, just being a medical assistant in general, gives you the aspect of the medical field to see if the medical field is for you, like any other field. So this is like the basic type of medical job you can get. Anyways, I'm going to cut it short. If you have any questions, comments, concerns, let me know. Again, share, and don't be a stranger. I'll be making more videos for sure. Take care.